Well, good afternoon, and thanks to all of you for joining us today. I hope all of you had a nice weekend and a belated happy Father's Day and happy Juneteenth to all of you. But thanks for being here this afternoon. Last Thursday, we changed things and held this briefing in Northern Virginia, focused on the disproportionate impact this virus is having on the Latino population. As we look toward moving into Phase 3, it's critical to acknowledge and work to change the disproportionate impact of the pandemic on Black and brown communities. As you saw last week, we have a strong plan in place to do just that. Statewide, our data continue to look good. VDH continues to hire contact tracers. As of yesterday, there were about 1,000 contact tracers on board, including existing staff and new hires. As you can see on this slide, we're seeing a decline in people hospitalized with a positive or pending COVID test. That has been trending downward for a couple of weeks. And just to kind of highlight that slide, the light blue on the bottom are COVID-19 patients who are on ventilators, and as you can see, that's trending downward. A little bit darker blue in the middle there are COVID-19 patients that are currently in the ICU, and again, that is trending downward. And then the dark blue just under the yellow line is the total hospitalized COVID-19 patients. So all of those continue to trend downward. And on this slide, you can see that our hospitals continue to have bed capacity. And I think that slide is fairly self-explanatory. As of June the 2nd, we have averaged between 8,000 and 12,000 tests per day. And on this slide, you can see that our percentage of positive tests has been trending downward and is now at 6.4%. And I want to remind all of you, this is because Virginians, you, have followed the guidelines of social distancing, hand washing, and use of facial protection, and we encourage you to continue doing that. We have enough PPE for our hospitals, and we continue to work with other health settings to ensure that they have the PPE that they need. Since last Friday, we have distributed a total of 38 shipments of PPE, primarily to local jurisdictions, assisted living facilities, and higher education. The Reform Alliance has donated 170,000 disposable 3-ply masks to Virginia, and we're distributing that to jails and correctional facilities. So a thank you from the Commonwealth of Virginia to the Reform Alliance. We also have more than a dozen different PPE contracts so that our supply chain remains diversified. To date, we have distributed nearly 860,000 N95 masks around the state, more than 1.6 million surgical masks, and around 4.4 million gloves. With all of this data, we are comfortable planning to move into Phase 3 next week on Wednesday, July the 1st. This gives us about 3.5 weeks in Phase 2 where we have been able to follow the data. It continues to continue to be surges in other states, and we are monitoring that very closely. We outlined what Phase 3 will look like last week. It still means you're safer at home, especially if you're vulnerable. It means we're still strongly encouraging teleworking. People still need to focus on physical distancing in all situations outside of their home. Face coverings are still the right thing to do in indoor public spaces. But Phase 3 will also bring some changes. Social gatherings may include up to 250 people. The cap on capacity for non-essential retail will be lifted. So will the cap on capacity for restaurants and beverage services, but physical distancing is still required. Entertainment venues like museums, zoos, and other outdoor venues may open at 50% capacity with a cap of 1,000 people. Gyms and fitness centers may be open up to 75% of capacity. Personal grooming services such as hair salons will still need to follow physical distancing requirements. Child care facilities may be open. Overnight summer camps will still be closed. Recreational sports will still require physical distancing, and swimming pools may be open at 75% of capacity with physical distancing. I want to reiterate that everyone should continue to take this pandemic very seriously. Cases are on the rise in many other states, as I said previously. I do not want to see that happen in our Commonwealth. Be cautious and take the necessary steps to protect yourself and the people around you. That means face coverings, which are increasingly supported by the science. It means physical distancing and frequent hand washing. Now I'd like to touch on guidance that we announced last week for our long-term care facilities. VDH has put out its state guidance for how long-term care facilities can gradually lift restrictions. That's on our website, and I would encourage all of you to review that. And we said we'll provide the facilities with additional financial assistance. We're directing $246 million in funding, mostly from the CARES Act, to support long-term care facilities. That funding includes $152 million from the Provider Relief Fund that goes directly to facilities. This will help facilities address staffing shortages, infection control measures, PPE purchases, and new periodic testing requirements. I know that these past months have been a hard time for every resident of long-term care facilities, their families, and the staffs who work there. It's difficult when you can't see an aging parent to see how they're doing. I have also directed the Department of Health to release the names of long-term care facilities with outbreaks. In doing this, we have consulted with Dr. Oliver, the Health Commissioner. Given that CMS is releasing federal data, some of which, by the way, is incorrect, we felt it was important to take another look at this. Now that there are more cases in these facilities, we can make an exception and release this information without compromising confidentiality. Long-term care facilities are home to some of our most vulnerable Virginians, and we will continue to make them a top priority of our COVID-19 response. That's why our funding package includes more than $56 million for periodic testing of nursing home residents and staff. As I have said throughout this pandemic, I want to provide as much information as possible under Virginia law. We believe there is room for more clarity in the law on this, and we are discussing legislative options with our fellow lawmakers. I understand that it's been difficult for families who wanted this information about the facilities where their loved ones are living, and it's time we make this change. As we continue to fight this pandemic on the health front, we also are working on our economic recovery. Earlier this month, we announced that Agriculture and Forestry Industry Development Fund grants will be available for proposals that help agriculture and forestry businesses deal with COVID-19 related challenges. And last week, we announced a new economic resilience and recovery program through Go Virginia. We've also been pleased to announce new companies coming to Virginia, such as a hemp processing facility located in Halifax County and a fiber manufacturer coming to Henry County. You saw a new IT firm in Henrico and a new ship repair and manufacturing company in Newport News. We'll have more to say about next steps in our economic recovery on Thursday, as well as more economic announcements in the days ahead. But these are encouraging signs for our economy. Finally, I want to address the ongoing protests that started several weeks ago with the killing of George Floyd. There have been 482 demonstrations in communities across our Commonwealth. They have helped focus attention on issues of racial justice and injustice, and have pushed necessary action on Confederate monuments and future action on police reform and other important equity issues. Action is coming, and new laws starting July the 1st reflect my commitment to criminal justice reform. Mostly, these demonstrations have been peaceful, but here in Richmond, we continue to see nightly conflicts between protesters and our police, where the state police are in a support role to help out Richmond police, who are in the lead role. But after 3 weeks, it is no longer clear what the goals are or a path to achieve them. Clearly, Richmond needs a different path forward. These nightly conflicts cannot continue indefinitely. I am hopeful the city and protesters can continue working toward meaningful policy change. Now I'll ask Virginia's Health Commissioner, Dr. Norm Oliver, to give an update on our health numbers, and then we'll be glad to take your questions. Dr. Oliver, welcome.
Very briefly on the numbers on our COVID-19 cases. We currently stand at 58,994 total cases of COVID-19 in the Commonwealth. That's 529 new cases in the last 24-hour reporting period. Total deaths stand at 1,645, and that's 25 deaths in the last reporting period. And as the governor pointed out, our cases have been declining. Total tests are up to 627,248. Yesterday, we reported 10,228 new PCR tests. I'll forego going through the demographic breakdown that I used to do. As you know, if you go to our website, vdh.virginia.gov, you can now get a breakdown on cases, deaths, and hospitalizations for Asian and Pacific Islanders, African Americans, Latinos, Native Americans, and others. And I encourage you to visit that site for that information and other important information to help inform you about what's going on with this pandemic. Thank you, Governor.
Yes, thanks, Dr. Cam.
Governor, just to clarify, for the movement into Phase 3, does that include the city of Richmond and Northern Virginia, which are behind in their Phase 2?
Great question. The question is, will Richmond and Northern Virginia move into Phase 3 at the same time the rest of the Commonwealth? And until I hear differently, they will be moving forward. If they're not comfortable, Cam, if their numbers aren't to their satisfaction, then we'll certainly have that discussion. But to date, I haven't heard that they don't intend to be with the rest of the state. Jackie?
Oh, okay. Well, two things. So first of all, with the Department of Labor and Industry board, and within that department, is set to have a meeting tomorrow morning regarding some mandatory guidelines that many business groups have expressed frustration over, trying to figure out why there would be mandatory guidelines around social distancing, for example, now after weeks of recommendations. Can you speak to that, and do you have any recommendations for that board as they look to make a decision tomorrow?
I'm not sure if I completely understand your question, Jackie, but Doley is having a meeting and looking at the guidelines. So there's some businesses that may not be.
Yeah, so my understanding is that these would be mandatory after, for a long time, they've been more of recommendations. And there's been some uproar among business groups, to my understanding, wondering why now to release these and why would they be mandatory. So do you have any, can you just weigh in on that?
Sure. I'm going to let Dr. Healy come forward. Dr. Healy, thanks.
Thanks, Governor. The question is about the Safety and Health Codes Board that's meeting tomorrow. So in Executive Order 623, the Governor asked the Department of Labor to look at emergency temporary standards, and these are enforceable standards that can be temporary, and then it has to go through this board, even though the board is regulatory. So the Governor doesn't have oversight over this board, but he's asked for 4 things for Department of Labor to do, and that was around PPE in the workplace, sanitation, record keeping, as well as communication. So if an employee does have COVID-19, the employer must tell all the other employees that one person is infected, but not by name. And so there's been 10 days of public comment that ended on Monday. A lot of weigh-in from the business community about these particular standards. And so the board will meet tomorrow, and potentially if all these standards are passed, I hear there's amendments coming to the board. We'll find out tomorrow on Thursday that these standards would be posted online, and then they'll be enforceable by civil action.
The Governor, can you weigh in on whether or not you think that they should be mandatory at this point? Additional guidelines for businesses?
No, that was the whole purpose of making these guidelines. So yes, they will be.
Can you speak to the criticism? What would you say to businesses who feel like this? Why now?
Well, I just, it takes a little while to get all of these guidelines in place. Like Megan said, we've had public input, and this is all about safety for individuals coming to our places of business. And I think, Jackie, I haven't mentioned this for a few conferences, but the key to our economic recovery is to know that businesses are safe, that it will be consumer driven. And so that was the whole idea behind doing this, so that we will have guidelines in place, so when people choose to go into a business venue, that they can feel comfortable that they're going to be safe there.
Amy Friedenberger with the Roanoke Times.
Hi, I just wanted to follow up about the nursing home data. The explanation that your administration provided about why the nursing home and assisted living facility information is being released now had to do with the number of cases. And so, could that mean that you could rescind what you're doing now as cases go down, or are you committed to, now that this information is made public, will you keep it public while COVID continues to be an active health threat? And will you commit to changing the code during the upcoming special session to codify this change that your administration just made?
Yes, Amy, thank you for the question. And as I said earlier, the reason that we made the decision that we made is because of a lot of misinformation that was coming out of Washington, certainly near your area in Roanoke. And so I have always said that the more transparency that we have, the better, as long as we protect people's privacy. And the latter part of your question about the clarity in the code, and I've also been clear about that as well, that we do need more clarity, and we're having discussions with our legislators. We will have a special session probably in August, and whether it will be taken up during that special session or in the regular session in January, we haven't made that decision yet, but we'll certainly have that dialogue. And as soon as we have legislation that we feel will provide more clarity, then I will encourage the legislators to propose that. It will be vetted by different folks, and then hopefully bring more transparency to the process as we move forward.
Will you reconsider your administration's interpretation of the code in order to identify businesses with COVID outbreaks now that this exception has been made for the assisted living facilities?
Well, as I said, Amy, there's been no change in the code. This is in response to a lot of misinformation that was coming out of Washington, which was very confusing, and that's why the decision was made.
Following up on her question, I'm just wondering, now that VDH is releasing the names of nursing homes and assisted living facilities with COVID-19 outbreaks, I'm wondering if you'll be able to release the names of businesses like poultry plants with major outbreaks. And then my second question has...
Let's just stick with your first question first, if that's all right, Kate. It's all boils down to whether it's a public health risk. And so that's something that we will monitor moving forward. But the pandemic has changed. There are more nursing homes now that have had outbreaks, and so for the public health safety of individuals in these nursing homes, that's why the decision was made. As far as other businesses, we'll monitor that. If it becomes a public health risk, then it's something we'll address. But I think in also, and it goes along with what Amy asked, there needs to be more clarity. And you know, one of the things that this pandemic has done is it's brought out a lot of questions and different situations, and so we've learned, and we'll move forward and provide that clarity. So you had a second part.
Yeah, my second question has to do with reports on the dangers of use of chemical agents like tear gas and pepper spray during a respiratory pandemic. And we've seen those heavily deployed by law enforcement here in Richmond. So I'm wondering if that's a concern to you as a physician, and if you might, consider directing police not to use them.
Kate, obviously we don't like seeing the use of tear gas and rubber bullets. So no, I'm not going to direct the police how to do their work. But what I am going to say is that, we've had over 480 protests in the Commonwealth of Virginia. The great majority of them have been peaceful. And I just encourage Virginians as we move forward to keep their protests. I mean, that's a First Amendment right, but part of that is to be peaceful and not break the law. So we need people to abide by the law in the Commonwealth of Virginia. And obviously, the majority of these, that's what individuals have done. But as you saw last night in Richmond, an unlawful assembly was called a couple of times. People refused to leave, and so when people break the law, we can't condone that. And so, in order to keep the peace, the police are going to need to take the action that's necessary.
Bill Atkinson with the Progress Index.
Thank you, Marissa. Governor, has your administration reached out to the nursing homes about releasing this information, and are they on board with it? Because one of the main points they were staying so tight-lipped about this was because they were worried about losing their Medicare and Medicaid funding if that information got out. So what sort of feedback, if any, are you receiving from the nursing homes about releasing this information?
It's a good question. Do you want it, Laura?
Hi, the question's about whether we've gotten some feedback about the recent policy decisions around releasing the names. I have regular contact with stakeholders in the long-term care facility community. We meet regularly with their associations as well as representatives of individual facilities. We'll be scheduling a training on the new guidance and an opportunity to answer questions towards probably the tail end of this week. The information is already reported to the health department, so numbers of cases are already a reportable condition to the health department, so that knowledge is already known to VDH. Thanks.
If I could follow up real quick on that, is the information on the outbreaks at these nursing homes, is that available on the website right now, or when will that be available?
So available on the website right now is a list of long-term care facilities, nursing home and assisted living facilities that have had outbreaks of COVID-19. It includes the number of cases and the number of deaths in each facility. Very small numbers are suppressed in order to protect patient privacy.
I just wanted a quick follow-up. Kate, I read your article, and I want to compliment you on the article. Just a lot of really good information in it. And one of the things that I wanted to remind all Virginians, a lot of us have loved ones in nursing homes and long-term care facilities. I have my 95-year-old father, and one of the questions that he asks is, when can you come visit me? And so I would encourage people to go to the website, which is actually part of your article. If they read your article, they can just highlight it, and it will direct them to that website, and it will outline the guidelines going into Phase 3 on being able to visit our loved ones in the nursing home. So I appreciate your work.
All right. Governor, you're announcing the move or the date for Phase 3
Yes.
on a day when I think COVID deaths are at their highest in about 3 weeks. Do you see the daily death total as a kind of a one-off, or are you expecting increases, but as long as the hospitals have capacity and all that, it's okay?
And Laura, are you referring to deaths in Virginia?
I believe so. Is that incorrect?
If you want.
So the question is, given that the deaths have increased, the reported deaths, are we being premature and going to phase 3? The important thing to realize when looking at that piece of information is that deaths are what we would call a lagging indicator. They occur, you get a reported positive case, we know about that within days. Someone gets sick, spends a period of time in the hospital, perhaps in a nursing home, and then passes away. That gets recorded many weeks later. What's reported yesterday in terms of deaths reflects something that happened weeks and weeks ago. The more sensitive things to look at are the key measures that we've pointed to, like the test positivity, what's going on with the hospitalizations, and so on. And all of those key measures are trending down, as the governor said. And that's the important factor here.
Michelle Bash with WTOP.
Yes, Governor, are you prepared to roll back or slow down Virginia's reopening if a spike in cases starts here or if spikes continue in other states?
It's a great question, and I will use your question to remind Virginians that it is in all of our hands as we move forward. We all have a responsibility to continue the social distancing, the hand washing, not gathering in large groups. And if we can continue to do that, I think our numbers will continue to trend favorably. The question was, will we go back to phase 2 or phase 1 if we need to? Obviously, if we see surges in the Commonwealth and we're going in the wrong direction, then obviously we're going to have to make difficult decisions to do that. But one of the reasons that we are where we are today, and I would never have made this decision that I did, is if I weren't confident in our hospital capacity. They've done a wonderful job. As you remember, they stopped doing elective surgeries to really increase their PPE, their staffing, their ventilators, et cetera. So that has a lot to do with this. Also, the fact that we now have the testing capabilities, and we're in the ballpark every day of 10,000. I really anticipate that will increase, especially as we allow students to come back onto campuses. There's going to be more testing, more prevalence testing out there. So that has ramped up every day to a point where I'm comfortable that we can look at different areas of Virginia by health district if we need to do more testing, if we see the numbers going up, that we have that ability. And then finally, the tracing we've been talking about every day is that we now have around 1,000 tracers. We will have more as we move forward. And so all of those things together allow us to be where we are today and to really try to open up our economy, get people back to work, and get back to that near normal. But I think the reality, and we need to remind ourselves, is that this virus is still out there. It is still very contagious. And as I said earlier, we need to take this very seriously. And if we don't, if we become complacent and don't continue to follow these guidelines, then the possibilities are there that we would have to go back. And I don't want to do that. I don't think anybody wants to do that.
Governor, we're getting a couple phone calls from folks in the funeral industry. These are directors and embalmers. They've been looking for PPE. They found some places that supply these items, but they're marked up quite a bit. And I know you've talked about having all of this available.
Yes.
And so they said they called some of the numbers on the website, but they haven't gotten calls back.
Okay.
Some of the numbers aren't functional. So just looking for some guidance there. And then also...
Let me, just on that one, because I would encourage them, Andre, to go through their vendors. If they're unable to obtain the PPE that they need, to go through the local health districts and ask them for assistance, and then also through the local Department of Emergency Management. So any of those avenues would work. And then finally, we have what we call our VEST task force, and if they can't get the help they need, if they would get in touch with us, we would help them. We would direct them to where they can get help. But the bottom line is we have PPE, and if they're having difficulty obtaining that, we would certainly want to know about it. We want to help them.
Okay. And secondly, if I may, a few conferences back, you mentioned that you would meet with protesters, but it wasn't time yet. Now that we're seeing so much continued unrest, are you ready to meet with these protesters? And if so, what would you say to them as the governor?
Well, again, yes, I'd be more than willing to meet them. Obviously, we need to do it in a safe environment. And I would encourage them to continue to be peaceful and advocate and let us know what they intend to get out of all the protesting. I think, for the most part, Andre, I have listened, not face to face, but I listened to a lot of protesters. I recognize the pain. I know that the great majority of all of this, it started after the death of George Floyd because of the tremendous pain over the inequities, the 400 years of history, the things that we've talked about. So I'm more than willing to continue. And as you know, we've set up, are in the process of setting up listening tours across Virginia to really listen and address those inequities. But what I can't condone is the unlawful protesting. And the great majority, especially during the daytime, Andre, that we've witnessed, have been very peaceful, and we're all very supportive of that. But after the sun goes down, there seems to be a different agenda, and that's what we need to. I need to hear from these individuals. What do they want, and what we can do policy-wise to change a new path forward. I don't have my schedule in front of me, Andre, so I don't know when the different meetings have been set up, but they will be in the near future.
On the phone? Max Thornberry with the Northern Virginia Daily.
Yeah, I have a question about unemployment benefits and insurance. Is there any way for the Virginia Employment Commission to be able to track people that are refusing to go back to work because they are making more money on unemployment? Maybe they have been offered their job, but they aren't going back. Is there any way for the Employment Commission to track that other than relying on businesses and employees to self-report that?
Yes, we have been tracking that. Megan, you want to address that?
The question was around unemployment insurance and the people that have refused to go back to work, and if it's because of the additional benefits. We do not track that data. We know that around 12,000, I think it's 12,700 people have refused to go back to work, and they move through the adjudication appeals process that we cut their benefits. If someone lacks child care or has a medical condition, then their appeals process is expedited, but we don't ask those specific questions of why they refuse to go back to work.
Good afternoon, Governor. Quick question on the release of the data for the nursing and long-term care facilities. Why not go ahead and also release the data for outbreaks at other facilities across the state, such as correctional institutions, behavioral health facilities, things like that?
Yeah, again, as I said earlier, if it becomes a public health issue, crisis, then we'll certainly look into that. But for right now, we've made the decision to release that information on our nursing homes. And again, not to be a broken record, but there remains lack of clarity in our code, and so we look forward to addressing that with our legislators.
Now, last question. Hi, can you talk about the decision to close the Lee Monument grounds after
Yes.
sunset? The ACLU, for example, said they felt that it was anti-free speech, and that just from being out there, it seems like the decision felt
antagonizing to some of the protesters. So can you talk about the decision and if you are worried that it might yield more unrest?
Yeah, the question is about the Lee Monument and the little circle surrounding the Lee Monument. And, you know, Mel, I have been impressed that the majority of the gatherings around the Lee Monument during the daytime hours have been peaceful, and we encourage that. There was actually even, I believe, a wedding ceremony I saw a few days ago. But what I am worried about is after the sun goes down, when it seems to be a different crowd that comes to the Lee Monument area. And as I've said, that statue is 12 tons, and it becomes a safety issue. And we're responsible for what goes on in that circle. And so that's why I made the decision that I made, is that after the sun goes down, we encourage people to be peaceful and have their protests, have their gatherings during the daytime. But after the sun goes down, it becomes a liability, a safety issue. And so that's why I made the decision I made. And I would also say that it's unfortunate that this process is in the legal system. My intentions were to take that statue down a few days after I made the announcement, and because of the legal process, we've been unable to. But we're going to work through that process, and I'm confident that when we get through that the Lee Monument will be taken down. Thank you all very much, and we look forward to being with you on Thursday. Thank you.